2.2 Overview for Assisters. This webinar is a joint effort between the Healthcare Authority and Health Benefit Exchange to provide guidance for individuals assisting Apple Health families to apply for and renew their Apple Health coverage in the Healthplanfinder web portal. Assisters include Health Benefit Exchange in-person assisters, brokers, and volunteer Healthcare Authority community partners with Healthplanfinder access. Today's webinar will introduce you to a new function in Healthplanfinder called Medicaid Plan Selection, or commonly referred to as MPS. These changes will be implemented on May 11, 2015. Today we'll be covering the following topics as part of Release 2.2. We'll begin with a general overview of Medicaid plan selection. Next, we'll discuss determining eligibility for Apple Health coverage, and then move on to completing enrollment into an Apple Health managed care plan. This includes how to select a managed care plan for Apple Health, search for a plan by provider, review changes to the individual dashboard, and share new system messaging in Healthplanfinder. Lastly, we'll cover how Medicaid plan selection works when reporting a change or completing your annual renewal in Healthplanfinder. Throughout our presentation today, we'll incorporate scenarios to provide a better understanding of Medicaid plan selection. Let's get started. Let's review our learning objectives. Upon completion of this webinar, you will be able to define Medicaid plan selection functionality through Healthplanfinder, identify the steps and outcomes for enrollment, describe features on the individual dashboard, and explain how to change a managed care plan in Healthplanfinder. Before Medicaid plan selection, individuals were auto-enrolled through Provider One into a managed care plan. Provider One is the system of record for Apple Health enrollments for all Apple Health eligible members. This system will continue to maintain the Apple Health managed care and other enrollment history. Provider One is a system external to the Healthplanfinder application portal. With the implementation of Medicaid plan selection, individuals can now review and select a managed care plan in Healthplanfinder. An individual or family that qualifies for Apple Health programs may create an account, although account creation is optional for Apple Health applicants. Next, the individual will enter information about themselves on their application, which determines their eligibility results. Once determined eligible for Apple Health coverage, the eligibility results are sent to Provider One. The new steps include Provider One sending managed care plan options to Healthplanfinder. At this point, the individual has the option to choose Skip Plan Selection and will be auto-enrolled into a plan by Provider One. If the individual does not skip plan selection, they can move forward with selecting a plan, and Healthplanfinder will send the plan information to Provider One. Enrollment into an Apple Health managed care plan is now complete. Throughout the presentation, we may refer to the following systems or partners: ES, which is the Eligibility Determination Service managed by DSHS, which is the Department of Social and Health Services; Provider One, which is the external system of record for Apple Health; and HCA, the Healthcare Authority, which oversees Apple Health Medicaid. Let's summarize the features of Medicaid plan selection. Apple Health eligible individuals can select and enroll in a plan through Healthplanfinder. Provider One will determine plan options for individuals eligible for Apple Health coverage. Apple Health individuals can search for multiple providers and compare plans within Healthplanfinder. If individuals eligible for Apple Health don't select a plan, they will be auto-enrolled by Provider One. There are two parts to gaining coverage in Apple Health. Part 1 is determining eligibility for Apple Health coverage. Individuals must complete the application process in Healthplanfinder to determine their eligibility for coverage. Part 2 is completing enrollment in a managed care plan. Once an individual is determined eligible for Apple Health coverage, the system will determine whether they can enroll in a managed care plan. Now that we have talked about the two-part process, let's talk a little more about Part 1, determining eligibility for Apple Health coverage. This is the eligibility status page, where the individual can view the eligibility results for each person requesting coverage on the application. The alert bar indicates how many household members require further action. The individual tabs provide a quick summary of eligibility status for the entire household. Clicking on the individual tab for each household member in the left navigation bar, the primary applicant can review each household member's eligibility status and next steps. From the eligibility status screen, the individual can click Next, and their household summary modal will be opened. This page provides a high-level summary of the coverage each household member listed on the application will be receiving. They will be prompted to click Continue to go to the next page. Depending on the information sent from Provider 1, the individual may or may not be able to select a managed care plan. We will go into detail about that in our next section. Now that we have reviewed Part 1, determining eligibility for Apple Health coverage, in this next section we will discuss Part 2, completing enrollment in an Apple Health managed care plan. Not everyone will be eligible to select a managed care plan. In this section, we will cover scenarios of the household summary screens. This includes what a managed care plan is versus coverage without a managed care plan, the process by which eligibility for these plans is determined, and the role of Provider 1. This is the household summary modal, which lists the managed care plan options for a household member. These include coverage without a managed care plan, or coverage without a managed care plan exempt, but can proceed to select managed care plan. This is the household summary modal for a household member who is currently enrolled in a managed care plan. There are instances where Apple Health eligible individuals cannot select a managed care plan. In this example, the individual already has coverage through TRICARE, so they would see the information on this screen. Other examples where the individual would see this result include when an individual is eligible for Alien Emergency Medical, AEM, or when eligibility for Apple Health coverage has ended. We will now cover 3 scenarios, all for new applications receiving different eligibility results. First, we will cover an Apple Health only household. This is the eligibility status page, where the individual will view the eligibility results for every person requesting coverage on this application. In this scenario, the primary applicant and the entire household are approved for Apple Health coverage. From the eligibility status screen, the individual will click Next, and their household summary modal will be opened. This page provides a high-level summary of the coverage each household member listed on the application will be receiving and next steps. They will need to click Continue to begin the managed care plan selection process. Next, we will cover a mixed Apple Health qualified health plan with tax credits household. We'll often refer to a qualified health plan as QHP during today's presentation. This page is the eligibility status page, where the applicant will view the eligibility results for every person requesting coverage on this application. In this example, this household returned mixed eligibility results. When the applicant clicks Next on the eligibility status page, their household summary modal will appear. From the eligibility status screen, the individual will click Next, and their household summary will be opened. This page provides a high-level summary of the coverage each household member listed on the application will be receiving and next steps. They will need to click Continue to begin the managed care plan selection process. As this is a mixed household, the individual will first select plans for the Apple Health household members, and once completed, they will shop for coverage for the Qualified Health Plan or QHP household members. Now let's talk about how an individual selects a plan through Medicaid plan selection. In the last section, we left off on the household summary screen, which before Medicaid plan selection would be the final step in Healthplanfinder for Apple Health recipients. With Medicaid plan selection, the Apple Health individual has the option to select a managed care plan that best fits their needs based on plans available in their area. The Apple Health individual can take two enrollment paths: select a managed care plan or skip plan selection. Let's dive into option 1, select a managed care plan. Clicking Continue on the household summary will navigate the individual to their Explore Your Options screen to select a managed care plan. We'll refer often to the Explore Your Options screen as the EYO screen in today's presentation. On the Explore Your Options, or EYO screen, they will see which managed care plans are available to them. The managed care plans that the individual is eligible for will be returned by Provider 1 and displayed on the page. Under My Search, an individual can see all individuals who are eligible to select a plan, search by provider, and search by clinic hospital. An individual can use Customize My Search to filter by managed care plan. Each managed care plan offers additional information. By clicking More Information on this plan, they will be able to view benefit information. Benefit information will essentially be the same for all Apple Health managed care plans. After browsing, the individual will click Select on the managed care plan of their choice. The individual will be navigated to the household summary page, where they will see that their enrollment has been approved by HCA and returned to Healthplanfinder by Provider 1. Once clicking Next, they will be navigated to their individual dashboard, where all enrollments, coverage, and managed care plans will be displayed. Please note that Apple Health for Kids with premiums, also referred to as CHIP premiums, cannot be paid through Healthplanfinder, and payments will not be displayed on the household summary page. Households eligible for Apple Health for Kids with premiums will receive a monthly invoice from the Office of Financial Recovery. The individual will see their enrollment and plan selection is finished. For new individuals, the coverage start date rules go as follows. The individual will be covered by Apple Health starting the first of the month of application. The red arrow demonstrates that this example individual applied on 12/4, so he is covered starting 12/1. The newly selected Apple Health Managed Care Plan will start the first of the month following plan selection, if selected by the second to last business day of the month. For example, if they select a plan on 12/20, they will be covered with that new plan starting 1/1. If they select their plan after the second to last business day of the month, they will be covered by their new plan starting the first of the next following month. For example, if they select a plan on 12/31, their new plan will begin 2/1, but their Apple Health coverage will begin on 12/1. Let's move on to option 2, skip plan selection. The individual has the opportunity to opt out of plan selection by clicking Skip Plan Selection on their Explore Your Options page. If the individual skips plan selection, they will be auto-enrolled by Provider 1. The individual will be navigated directly to their individual dashboard, where they can see their Apple Health coverage. This is what their dashboard will look like right after opting out of plan selection. The individual is able to select a managed care plan by clicking on the Enrolled link. When the individual is enrolled in a managed care plan overnight in Provider 1, their managed care plan will be displayed in Healthplanfinder. We will now cover 3 additional scenarios, all for new applications for different applicant types. The 3 scenarios we'll cover to better understand the Medicaid plan selection experience for new applicants includes Apple Health only household with no American Indian Alaska Native members, also referred to as AIAN throughout today's presentation. Mixed household, qualified health plan, and Apple Health, American Indian, Alaska Native, or AIAN Apple Health individuals and households. First, we will cover an Apple Health only household, none of whose members are AIAN. The primary applicant will see the current enrollments for each individual within their Apple Health household on the Household Summary Modal. They will be prompted to click Continue to move forward with processing their application. If the primary applicant is new to Apple Health and Healthplanfinder and they are not seeking coverage, the household will not be able to continue with plan selection and will be navigated back to their dashboard. They will still be covered under Apple Health and will be automatically enrolled in a managed care plan at a later date, as determined by HCA. However, if the family has had Apple Health coverage in the past, they will be able to proceed with plan selection, even if the primary applicant is not seeking coverage. Provider 1 will return common managed care plans for the entire household, meaning the managed care plans available that every member of the household is eligible for. They will be able to customize their search by managed care plan. The primary applicant may choose only one managed care plan to cover the entire household. Even if the Apple Health only household members are on different Apple Health programs, such as children are eligible for Apple Health for kids and mother is eligible for Apple Health for pregnant women, their EYO page will only display the common managed care plans which apply to all members of the household, and one managed care plan will still need to be selected. After they select the managed care plan for their household, the primary applicant will navigate through the rest of the application and end up on their dashboard where they will see all enrollments for their household as previously discussed. Each Apple Health eligible household member can select up to one preferred healthcare provider and one preferred clinic hospital. Healthplanfinder can then be filtered to display plans which accept those providers. Individuals can search for specialists in addition to primary physicians, but they can only select one provider per household member. Selecting a provider or clinic hospital is optional. Over the next few slides, we'll discuss how to search for and add healthcare providers and clinic hospitals for each household member. We'll also review how those provider preferences can be used to filter managed care plans accordingly. Apple Health eligible individuals can search for healthcare providers using these search criteria. The individual must select at least one criteria to search with other than distance in miles. In this example, the individual is choosing to search by zip code and distance. On this page, individuals can also add a provider's first and or last name if they are searching for a specific person. Based on the search criteria provided, Healthplanfinder will return the results that meet that criteria. The individual can then find more information on each provider by clicking on the provider's name or by clicking Get More Information. The provider directory will be updated periodically, scheduled to be determined. The provider search will only find providers that are in network with at least one managed care plan. As a result, tribal clinics and their providers will not appear in the search results unless they are in-network with a managed care plan, such as a doctor practicing at both a tribal clinic and a hospital. Individuals can view more information about each healthcare provider before making a formal selection. Once an individual reviews their provider search results, they can select a specific healthcare provider for each family member. Note that while you can select different providers for each individual Apple Health eligible family member, only one managed care plan must be selected for all Apple Health eligible family members. Similar to adding a healthcare provider, the individual will click Add underneath Search by Clinic Hospital to search for and select a clinic hospital for each household member. While you can select different clinic hospitals for each individual Apple Health eligible family member, only one managed care plan must be selected for all Apple Health eligible family members. The healthcare clinic hospital search functionality is only available for those going through Medicaid plan selection. The healthcare clinic hospital search option is not available for those shopping for a qualified health plan. Apple Health individuals can search for healthcare clinics, hospitals, using these search criteria. The individual must select at least one criteria to search with other than distance in miles. In this example, the individual is choosing to search by zip code and distance. The search will display any results that contain the text the individual entered. For example, if an individual enters ME in the search bar, their results could include Army Medical Center and Mercy Hospital. Based on the search criteria provided, Healthplanfinder will return the results that meet that criteria. The individual can then find more information on each clinic hospital by clicking Get More Information or by clicking on the clinic hospital's name. Once an individual reviews their clinic hospital search results, they can select a specific clinic hospital for each family member. The provider directory will be updated periodically, scheduled to be determined. The clinic hospital search will only find clinic hospitals that are in-network with at least one managed care plan. As a result, tribal clinics and their providers will not appear in the search results unless they are in-network with a managed care plan, such as a doctor practicing at both a tribal clinic and a hospital. Once healthcare providers and hospital clinic selections have been made for each family member, the primary applicant can filter plans by best match. A table will appear on each plan summary indicating if the providers that the individual selected are available for that plan. Plans with the best match will be displayed first. A, B, and C show how the plan matches with the individual selected providers and hospital clinics for each household member. This table lists tips for data validation when searching for a provider or clinic hospital. The data validation message column lists the error that may be seen. The tips column shares why the messages may have been received. Next, we'll review a mixed Apple Health and qualified health plan household, none of whose members are AIAN. The primary applicant will see the current enrollments for their entire household on the Household Summary Modal, including QHP with or without tax credits and Apple Health. They will be prompted to click Continue to move forward with processing their application. The primary applicant will be navigated to the EYO page for the Apple Health eligible members of their household. All Apple Health eligible household members will be listed under Looking for a Plan to Cover. They will be able to customize their search by managed care plan. If there are multiple members in this household that are Apple Health eligible, This will follow the same business rules as the Apple Health only household. Provider 1 will return common managed care plans that the primary applicant can select for the household, which will apply to every Apple Health eligible member of the household. Any members of the household who are not covered by Apple Health will be indicated by the Does Not Cover section. After the primary applicant has selected a managed care plan for the Apple Health eligible members of the household, they will be navigated to the EYO page for any QHP eligible members of the household. There, they will select and purchase a qualified health plan for those eligible members of their household before moving on to finalize all selections within the household. Only in a mixed Apple Health household will the primary applicant view the final confirmation page after selecting their QHP coverage. The final confirmation page will display the selected plans for only the QHP individuals in the household. Lastly, let's review an AIAN Apple Health individual and household scenario. Like any other household application, the household summary modal will display the enrollments of each individual in Apple Health. When they click Continue, they will be navigated to the EYO page for AIAN. If this is a mixed household with AIAN Apple Health and non-AIAN Apple Health members, the household will first be directed to the non-AIAN Apple Health Explore Your Options page and then the AIAN Apple Health Explore Your Options page. The Explore Your Options page will display managed care plans available to the AIAN Apple Health individual or household members. For an AIAN Apple Health household, they must select a common managed care plan for all AIAN Apple Health members of that household who choose to enroll in a managed care plan. For mixed households with both Apple Health non-AIAN and Apple Health AIAN members, the individual will first be directed to the Apple Health Explore Your Options page to select a managed care plan for those non-AIAN household members, and next to the Apple Health AIAN Explore Your Options page. Coverage without a managed care plan is a plan type returned by a Provider 1 as an option only for AIAN individuals. If the individual chooses that option, they will not be enrolled in a managed care plan and will be enrolled in coverage without a managed care plan. The individual is still covered by Apple Health. The AIAN individual household may customize their plan search by managed care plan or plan type. This is unique to the AIAN individual, as typical Apple Health individuals can only search by managed care plan. The two plan types the AIAN individual may search for are no managed care and managed care plan. For AIAN Apple Health households, the primary applicant has the option to choose one managed care plan for the Apple Health AIAN individuals in the household or choose coverage without a managed care plan for the AIAN members of the household that do want to select a managed care plan. They cannot make individual plan choices for each AIAN member of the household who want to select an Apple Health managed care plan. In terms of the process flow, after this EYO screen, if there are QHP eligible members of the household, they will be directed to the QHP shopping experience. In the three scenarios reviewed, the primary applicant may decide to skip plan selection for the Apple Health individuals in their household on the EYO page. The family will be covered without a managed care plan. In a mixed household, HCA may elect to enroll the non-AIAN Apple Health eligible family members in an available managed care plan at any time. This will not occur for the AIAN Apple Health eligible family members. At any point, the primary applicant may log into Healthplanfinder and select a plan for the Apple Health individuals in their household. We will now review the individual dashboard in the Healthplanfinder. This is what the individual dashboard on the Account Home tab looks like for an Apple Health individual or household. It will contain information and links to pull further information on the enrollment status and plan selected for each household member. The individual may click on the Enrolled link to navigate to the Apple Health Enrollment Details modal to retrieve more information on their specific managed care plan. If the individual clicks on the Enrolled link under Enrolled Status on the dashboard, this modal will appear with the following information: individual covered, managed care plan name, managed care plan start date, and managed care plan end date. This modal will always share this information on one line. From this modal, the individual can choose to change plans. The My Household coverage on the individual dashboard will contain the following information for each individual: individual covered, plan name, start date, end date, renewal date, and enrolled status. From this section, the individual can click on the Washington Apple Health hyperlink listed for each member of the household for more information on their selected managed care plan. A modal will pop up for each individual containing more information on the enrollment details and managed care plan selected of each individual. This modal will return additional information to the individual after clicking Washington Apple Health on their dashboard, including enrollment and eligibility information. The individual can view coverage through Apple Health under their eligibility status, plan name and plan type, and coverage start and end dates. We will now cover several of the plan selection prompts and modals which the individual may experience prior to or after the plan selection process. Let's review the system prompts or modals that may be seen before plan selection when no plan selection is available. After the eligibility status screen, one or more individuals in the household may not be allowed to move on to plan selection from the household summary modal, but they will be covered without a managed care plan. If this occurs, the individuals will not be able to move forward with plan selection and will be navigated to the Managed Care Plan Selection Details modal, which we'll review on the next slide. Some of the instances which will cause the individual not to be able to move forward with plan selection include if Healthplanfinder and Provider 1 are unable to interface, if Provider 1 does not pull any plans for the zip code provided, if the individual's Medicaid ACE's client ID number is not recognized by Provider 1, if there are any data validation errors, or other technical issues. If the primary applicant is new to Apple Health and Healthplanfinder and the individual is not seeking coverage, the household will not be able to continue with plan selection. They will be enrolled in Apple Health and will be automatically enrolled in a managed care plan at a later date as determined by HCA. However, if the family already has previous information, such as an account with Healthplanfinder or a Medicaid ACE's client ID number, they will be able to proceed with plan selection even if the primary applicant is not seeking coverage. The Apple Health Managed Care Plan Selection Details provides further information on who within the household can move forward with plan selection and who cannot. By clicking Continue, the primary applicant will be navigated to plan selection for those eligible individuals in the household. For those members identified as having no managed care plan available, here is an example of the modal which will list the reason why Apple Health member could not select a plan. By clicking Continue from this modal, the primary applicant will be taken back to their dashboard where the individual will see that they have Apple Health coverage without a managed care plan. For individuals who are not eligible to select a plan, they will receive information from Provider 1 about their auto-enrollment. Now let's review system prompts and modals after plan selection and possible enrollment statuses. Once the individual selects a plan for their household, they will be navigated to their household summary page, where Provider 1 will have returned one of the three following enrollment statuses: approved, pending, or rejected. In this screenshot, the household has received all different enrollment statuses for individuals within the household. If the individual selected plan is approved, the individual will be enrolled by Provider 1 overnight and no further action is needed. On the next slides, we'll go into detail regarding pending and rejected enrollments. If the individual selected managed care plan is pending, it will require manual review by HCA staff. The individual may or may not be enrolled into their selected managed care plan. Healthplanfinder will display the reason behind this pending enrollment and clarify next steps when the individual clicks Next to be taken to their dashboard. If the individual selected managed care plan is rejected, it will require manual review by HCA staff. The individual will not be enrolled into the selected managed care plan. Healthplanfinder will display the reasoning behind this rejected enrollment and clarify next steps when the individual clicks Next to be taken to their dashboard. We will now move on to change reporting. Change reporting is the process by which individuals report changes in Healthplanfinder. With Medicaid plan selection, there are no changes to the process of reporting a change in Healthplanfinder. Apple Health individuals can change their Apple Health managed care plan at any time. For Apple Health individuals, there is no cutoff when changes can be reported as long as Apple Health eligibility is approved. Some examples of changes that must be reported are birth, death, or divorce resulting in adding or removing household members, address change, income change, loss of minimum essential coverage, and pregnancy or change in pregnancy status. As we mentioned before, the process of reporting a change in Healthplanfinder is staying the same. After reporting a change in Healthplanfinder, if a family continues to be eligible for Apple Health, they will go through the managed care plan selection process. Similar to the initial application process, if an individual chooses not to select a plan, the system will automatically enroll the individual in the default plan at the end of the day. If their current plan is still available, they will be enrolled in that plan. If not, they will be enrolled in an available managed care plan by Provider 1 overnight. To report a change on Healthplanfinder, the individual will go through the same change reporting process that they do today. There are no changes to the change reporting link and screens in Healthplanfinder, starting from report a change in income or household through the primary applicant's signature page. After the change is submitted, the plan selection process and screens that the individual will encounter are the same as those we reviewed previously in this webinar. To review the process works like this. The individual reports the change on Healthplanfinder. The application is submitted with changes, and if the household is determined still eligible for Apple Health, the individual will have the following three options. 1, skip plan selection and be auto-enrolled in a managed care plan. 2, continue with their existing plan if the plan is still available. Or 3, select a new managed care plan. If the individual is no longer eligible for Apple Health, they will be directed to shop for a qualified health plan. As with the Apple Health initial enrollment process, individuals may choose to skip plan selection. To skip plan selection, the individual will log out, closing Healthplanfinder and ending the session, or click the Skip Plan Selection button at the bottom right of the EYO screen. If an individual skips plan selection, Provider 1 will enroll Apple Health eligible household members in a plan overnight. Also, if an individual skips plan selection and the same plan they were enrolled in is still available, they will remain enrolled in that plan. If the same plan is no longer available, a new managed care plan will be assigned overnight. Members who have been added and had no previous enrollment are automatically enrolled in the same plan that other household members were enrolled in before the change report was submitted. If the individual's current Apple Health plan is still available after change reporting, the individual can continue with the current plan by selecting the plan that the household is currently enrolled in. The individual's current plan, if still available, will be highlighted at the top of the EYO screen. If all members under Looking for Plan to Cover are eligible for the common current plan and it's available, it will be displayed and highlighted. For new and existing Apple Health households, individuals who select a plan will be enrolled by Provider 1 overnight. To select a new managed care plan after change reporting on the EYO screen, the individual would select a new plan for the household to be enrolled in Provider 1 overnight. When it comes to change reporting for Apple Health, there is a key date that we want to introduce to you all, the Managed Care Enrollment Cutoff Date. An important thing to remember is that these dates are determined by Healthcare Authority and the information is returned through the interface with Provider 1. The enrollment cutoff date is the day before the last business day of the month. If the change is submitted on or prior to the enrollment cutoff date, the individual's enrollment in a managed care plan starts on the first of the next month, June. If the change is submitted after this date, the Apple Health Managed Care Plan will start on the first of the month following the next, July. The individual's current coverage will continue until the next coverage begins. That means if a QHP individual reports a change on May 15th that makes her eligible for Apple Health, her enrollment in the new Apple Health plan will start on June 1st. She will be duly enrolled in her QHP plan and Apple Health coverage without a managed care plan through the end of the current month. To change plans without going through the change reporting process, or if an individual changes his or her mind after selecting a plan during change reporting, they can click on Enrolled on their dashboard to view the enrollment details modal. On this modal, the individual can change plans by simply clicking Change Plans. This will direct them to the EYO screen to select a new plan. The enrollment cutoff date that we reviewed earlier also applies to the managed care plan start date. So if the plan change is made on or before the enrollment cutoff date, the new plan will start the first of the next month. If the plan change is made after the enrollment cutoff date, the new plan start date will be the first of the month following the next month. Please remember that the current plan will continue until the new plan begins. In this next section, we'll review Apple Health renewals. There is no change to the Apple Health renewal process in Healthplanfinder. First, let's take a look at auto renewals. Around the 60th day before the certification end date, an attempt to auto-renew Apple Health coverage is completed. Healthplanfinder sends the individual's information to the Eligibility Service, which makes a determination as to whether the applicant is under the Medicaid income standard and remains eligible for Apple Health. If they are still eligible for Apple Health, they are renewed and sent the Apple Health Renewal, EE008, notification displayed on the screen. They will continue with their current managed care plan. If that plan is unavailable, they will be auto-enrolled by Provider 1 and receive a notification. Remember, even if they are auto-renewed, individuals have the option to change their managed care plan. Now let's review when an individual must complete a manual renewal. After manually renewing and found eligible for Apple Health coverage, the individual has the option to select an Apple Health plan rather than be auto-enrolled into the default plan. If the individual is no longer eligible for Apple Health after manual renewal, they will be given the option to shop for a qualified health plan with or without tax credits. We'll now finish up by reviewing a couple example scenarios on change reporting for Apple Health individuals. In this change reporting scenario, Johnny recently moved from Spokane Valley to Bellevue. He was previously enrolled in Apple Health, Molina, and now logs on to Healthplanfinder to report the change to his account on 5/15/2015. After going through the standard change reporting process, he signs to submit the change. After the change is submitted, Johnny will see that he is eligible for Apple Health on the eligibility status screen. He will click Next to go to the household summary modal and click Next again to explore his managed care options and select a plan. He decides to switch plans since the original Apple Health plan is not available in Bellevue. He selects a new plan, Coordinated Care. He will see the updated managed care plan details on his Apple Health modal. So this scenario is a little different since there is a mixed Apple Health and QHP eligibility in one household. Julie recently had her daughter, Kaylee, move back into her home and reports the change in Healthplanfinder on 5/15/2015. Julie was previously enrolled in a QHP with tax credits. She completes the standard change reporting process, submits the change, and sees Kaylee is qualified for Apple Health for Kids. On the eligibility status screen, they will see that Kaylee is eligible for Apple Health, while Julie is eligible for QHP with tax credits. More details and actions will be explained in the household summary page once they click Next. She will then have the opportunity to select an Apple Health plan for Kaylee. Once the plan has been selected for Kaylee, Julie will be navigated to shop for a plan for herself on the QHP Shopping EYO page. They will then be navigated to their dashboard. Julie will see the updated plan details on her account when she logs on the following day. Coverage without a managed care plan means that HCA will reimburse the provider for services during this period of time before the individual is enrolled in a managed care plan, which typically begins the first of the following month. Inquiries regarding Apple Health Medicaid coverage, Medicaid plan selection, or the volunteer HCA Community Partner with Enhanced Access Program may be directed to Medicaid Expansion at hca.wa.gov. For qualified health plan questions, please contact customer support at wahbexchange.org. For the in-person assister program, please contact your lead organization or navigator at wahbexchange.org. For brokers, please contact producer at wahbexchange.org. You have now completed the Healthplanfinder 2.2 Overview for Medicaid Plan Selection. The recorded version of this webinar and slides will be posted to the HCA Training and Education webpage at the link shown on this screen. Thank you for joining us to learn about Apple Health Medicaid Plan Selection.
Thanks, everyone. So we ask that you remain on the line. We're going to get started with a question and answer session. Okay, so question number one. After the client selects a managed care plan, can they pick which doctor's office or their doctor while there too?
Okay, sorry. This is Kathy Pickens-Rucker with the Healthcare Authority, and if I'm understanding the question right, you want to know if they can pick their primary care provider or their clinic or that information. They can do that on Healthplanfinder now. It's part of what was shown, and I think maybe you asked the question before we got to that part of the webinar. We did show where they can do that.
Okay. How late in the month can someone switch their Healthy Options or Apple Health Managed Care Plan and still be switched for the following month? Is the managed care plan switch cutoff the same calendar day every month, similar to the 23rd, like a QHP?
I think that the slides that we went through here at the very end clarified that it is the day before the last working day of the month. So generally we say a couple days before the end of the month. It does on certain months kind of move around, but it's always right there at the very end.
Where can we find a summary of benefits for the Apple Health plan? And that actually you can locate the address. It's the first link that's located on this screen that's showing right now. Will clients eligible for classic Medicaid only, such as SSI, long-term care, be using this process, or can they still call the Medical Assistance Customer Service Center?
They will not use this process. Classic Medicaid does not use Healthplanfinder, and this is all in Healthplanfinder. So they would continue the way they do today.
If a client selects a plan but needs to change because the provider does not accept the plan they selected, will they go onto their dashboard to make the change, or should they contact the Medical Assistance Customer Service Center at Healthcare Authority?
They'll have those both as options as well as the other options. And I think we tried to stress in here they can change their plan at any time. So if they do find out later that that provider they selected is not maybe taking new clients or had changed and is no longer in the network, they will be able to go in and change their plan.
Will the gap between initial enrollment in Medicaid coverage and enrollment in a managed care plan be explained? Many clients I help are extremely confused about when they are insured and believe they have no coverage until their managed care plan begins.
This is one of the things we have strived to help improve with this solution, and I think some of the examples we showed that their coverage will begin immediately or the beginning of the month that they were determined eligible for, and it will be coverage without a managed care plan. We tried not to use the term fee-for-service, and then shows their eligibility for their enrollment in the managed care plan then the following month. And that is the household summary modal, I think, showed that.
If someone skips plan selection, how long will it take for provider one to assign them to a managed care plan?
So the process will work overnight. That is how it's done today. And so if someone skipped it, or they, got knocked off the system, or they just didn't get done making their selection before 9:59 at night, then they will have to wait and see who we assign them to the next day.
Okay, so this is kind of a piggyback to that question. If a client chooses to skip managed care plan enrollment because they aren't sure which managed care plan they want yet, are they able to go back later to select their managed care plan after they've decided? Or are they just going to be automatically enrolled?
If they don't get back in before 9:59 that same night, they will get auto-enrolled. That doesn't mean they can't change the plan, though, later.
So a lot of people refer to fee-for-service by the slang term open coupon. Will there be a change to the term fee-for-service in the future? Clients get confused by the term fee-for-service and think it means they must pay a copay or deductible.
And so Coverage without a managed care plan is the best we've been able to come up with so far as a new phrase for describing what's known as fee-for-service.
So are you saying that new applications for clients who have never had Apple Health will not be able to choose a managed care plan in Healthplanfinder, but will be enrolled automatically?
No, that's not what we're saying. If they're new or returning, they can choose their plan. Only classic Medicaid cannot use Healthplanfinder.
What factors are used to determine which managed care plan someone may be eligible for? Is it only dependent upon their region?
I think that's the primary difference, is where the plan coverage is. So if they're in County A, they may have 5 plans because there's a large populace in that county. And if they're in County B, they may only have 2 or 3 choices. There are some counties where there is only 1 choice. And there they have fee-for-service as an alternative option. Anything else that, oh, that was good. Okay.
If someone initially opts out of plan selection, would they have the opportunity to go back and make a selection for their managed care plan within a certain time criteria?
I think we talked about that. As long as they go back in the same day, it'll take the place of not choosing. If they don't go in until later, they'll actually be changing their plan. So for example, if a client goes in today and they can't decide and they think, well, I'll wait and get more information, they've been determined eligible, provider one's going to assign them tonight. So if they go in tomorrow, they're actually going to see on their dashboard what plan we assigned them to, then they could change it.
Is this process still available via the Provider One client portal?
Yes, we have not removed any other avenues by which people can change their plans. They still have all those other choices, including the Provider One client portal.
For Apple Health eligible clients who live in a voluntary county, will there continue to be an option to select fee-for-service or coverage without a managed care plan?
Yes. And that will actually be offered. Fee-for-service, which shows up as coverage without a managed care plan, will actually be one of their choices.
Okay. Are we as assisters able to help patients' clients select a managed care plan, or is that something they are to review on their own? Per the Health Benefit Exchange rules, we are not allowed to help them select a qualified health plan. So I didn't know if this same rule applies to Apple Health managed care plans. So I'm assuming that that they're actually, this is probably a volunteer healthcare authority community partner with enhanced access and not a HBE in-person assister.
No, that probably is an HBE navigator assister. And
Right.
So the answer is they cannot recommend a plan, whether it's QHP or a managed care plan. The client needs to choose their own plan. The assister can help them by going through what doctors, what clinics are available in a plan, but they cannot steer that client towards any plan, whether it's QHP or Medicaid.
How would a client search for a clinic as opposed to a specific provider?
In the provider search feature, you can select clinics as well as providers. It's the same screen. So, for example, you would put in your zip code and the name of the clinic you were looking for.
Do all family members have to have the same provider or doctor's office?
No. There's a screen that pops up if there are multiple eligible members in the household. When you select the provider that you're interested in, it will ask you, is this for person A, person B, person C, and it'll list their names. And so you can say it's for this one, and then you go back and pick a different one. So each individual eligible member of your household can have one primary care and one clinic preference.
So will we now be able to do plan changes for clients through the Healthplanfinder?
Yes.
If a household member selects a clinic or doctor, will Washington Apple Health mail them a member card with that doctor clinic's name listed on it?
No, the cards won't change from the way they are today.
What about clients who have already been signed up for Apple Health? Will we now be able to view their managed care plan in Healthplanfinder?
Yes. That will show up very quickly for people who are currently enrolled starting next week. You could go in and look at their dashboard, and it would tell you which plan they're in right now.
How soon after enrollment in Apple Health coverage must one choose an Apple Health managed care plan? Does one have more time, like qualified health plan or QHP selection?
No, if they don't choose by the end of the day, which in this case is considered 9:59, we're going to auto-enroll them because we want them covered right away.
For a household who has split Washington Apple Health QHP eligible household members, can the member who is eligible for the qualified health plan shop for their plan at any time during the year, or must it be a special enrollment, open enrollment period?
Repeat the question.
Sure. For a household who has split Washington Apple Health QHP eligible members, can the member who is eligible for QHP shop for their plan at any time during the year, or must it be during special enrollment, open enrollment period?
All right. Anytime somebody wants to change a qualified health plan, it either needs to be during open enrollment or they have to have a qualifying life event so they can open up a special enrollment period for that person. So the rules are different for qualified health plans and Medicaid plan selection.
Will managed care plans still be able to assist individuals to enroll in a managed care plan through the Provider One client portal?
Yes.
Will coverage without a managed care plan not come up in Clown County, which is a volunteer county, if an applicant is not American Indian, Alaska Native?
No, it will come up for anybody because that's a voluntary county. So they'll have the option of a health plan and coverage without a health plan.
Are we saying that members will be able to choose their PCP, primary care provider, from these screens? How is this information going to be sent back to the health plan?
Yes, they will pick from these screens. They don't have to, but they can. And if they do, that information will be passed back to Provider One along with their plan choice. And then Provider One is the system that sends the information to the managed care plan.
So are you saying that family members all need to enroll in the same Apple Health managed care plan using this modality? If one person needs to be enrolled in a different managed care plan, can they go through the Provider One client portal to do so?
All family members must be enrolled in the same MCO. If there is a clinical reason for one member of the family to be in a different plan, that is something that needs to be called into the Medical Assistance Customer Service Center.
What are the pros and cons for an American Indian, Alaska Native to select coverage without a managed care plan versus selecting a managed care plan?
So the pros and cons are rather complex for different individuals. I would suggest that a tribal assister would be a good person to help people make those choices. In general, the right to exempt yourself out of a managed care plan, in other words, to have coverage without a managed care plan, is something that every American Indian and Alaska Native has. And If they wish to see a provider that is not participating in a Apple Health managed care plan, that is certainly one option for them to choose coverage without a managed care plan. Even the different tribal clinics have different ways in which they help American Indian and Alaska Native clients access care, either through the managed care plan or through coverage without a managed care plan. So it's actually fairly complex and depends on people's individual circumstances. So tribal assisters or even tribal clinics are the best place to go to get assistance on that issue.
Will the option to select more information on this plan show additional benefits that may be provided by certain managed care plans, such as vision hardware, sports physicals, Boys and Girls Club membership?
It does not. That link takes them to the standard booklet that lays out the essential benefits and some general information, but does not go into the uniqueness of each plan.
But if that is really important to the person you're assisting, then they need to contact the plan to find out what, I'll call them add-ons, they offer.
Or they can just, the plan websites all have that information as well.
Can clients designate their desired primary care provider using the Healthplanfinder managed care plan selection modal as they currently can using Provider One client portal?
I think we did answer that already. Yes, they can.
Will all Apple Health clients be in managed care?
No. It is a larger number now than it used to be, for certain, but it is not ever going to be all.
Will there be managed care plans available in Forks?
Yes, I believe there are managed care plans available in Forks, at least one and I think maybe two.
How do we as assisters most easily access the information that is available on the information on available providers in each managed care plan? How do we as assisters most easily access the information on available providers in each managed care plan?
The problem is going to be currency. Even within Healthplanfinder, where we have these provider networks now going to start showing up next week, it's reliant on updates because the networks change. Providers come and go. So we've asked the plans to try to keep that information very current, but it's going to be very difficult to find a comprehensive list at any given time. You could use the search features to look for specific providers, and then you could contact the managed care plans and ask them for network information.
Is the information we reviewed today on Medicaid plan selection, is this option currently available right now?
No. It starts on Monday at 7 o'clock, I think. And maybe this might be a good time to remind people that Healthplanfinder will be down all weekend while we implement this change. When we turn it back on Monday, this will be available.
For those who are enrolled in Washington Apple Health currently, beginning on May 11th, when Medicaid plan selection begins, are we able to click on the enrolled link to see their managed care plan in Healthplanfinder?
There's a couple steps you'd have to go through first to bring up their dashboard. But once you brought up their dashboard, then you could click on the enrolled and find their current plan.
If we as navigators help a person apply for coverage over the phone, but we do not create an account for the client, how can they go in and pick a plan? So I believe they would go in, and when they're asked to log in and they put in their pertinent information, it's going to take them to their sync them up with their current individual dashboard, and then they should be able to have the option under quick links too, or under the account home tab under their My Household, they'd be able to select through that way. Does that sound right? Okay. When a client decides not to select a plan and has been auto-assigned, what goes into that selection for them?
Can you repeat the question?
So when a client decides not to select a plan and has it auto-assigned to them, what goes into that selection for them?
So the process, just sort of in a nutshell, is we first look at the adequacy of the network that is proposed for the client service area. We also use a percentage of new enrollees who have had an initial health screening, as well as factoring in two quality measures, childhood immunization and diabetes retinal eye exam. If we take that data, it goes into Provider 1 as a calculation, and the plan selection is done all automatically on Provider 1. So there is nobody pushing a button to assign a particular person to a plan.
Is one managed care plan for Apple Health better than another?
Nope.
They cover the same basic services.
Yep. They all have the same benefit plan. They may administer those benefits differently. For example, one plan may require an authorization for something that another plan does not.
Then here's one more. When will this take effect in Healthplanfinder? So May 11th. Is there a publication that can be used to compare plan benefits, not just the general Apple Health benefits?
That's the only document that I know
No,
of.
we have a plan comparison chart, I believe, on the HCA website, but it does not include the incentive items and the value-added benefits. You would need to go to each plan website to find that information.
Go ahead. I want to mention on the Explore Your Options screen, we have attached a star rating and a consumer rating document to each of the plans, and it's actually the same document for each plan. But when you click on that and look at it, it shows you each of the Washington Apple Health Managed Care plans and how they compare to each other in a couple of different ways. The star ratings are based on different data than the consumer ratings. So those may be helpful for customers in making their choices, but they don't go into the benefits, the add-on type benefits that were mentioned earlier.
What is the phone number at Healthcare Authority that they can call to change their Apple Health plan? And that would be the Medical Assistance Customer Service Center, 1-800-562-3022. And it's the same phone number that's on the back of their Provider 1 services card. When a client chooses to be auto-enrolled, will they be re-enrolled into the managed care plan they had before their coverage ended?
If it's within 6 months, yes, they will.
Can Apple Health applicants browse managed care formularies before they select a plan?
I do not know for sure, but I believe that the plans do have generic general formularies on their website, but I do not know that for sure.
And it's not on Healthplanfinder or on HCA's website.
You can, the applicant can contact a plan if they're interested in enrolling but need to check the formulary.
So when we partner with a client can we still go in for them and change their plan now on Healthplanfinder instead of submitting a request the way we do now?
As long as the client has requested that the change be made.
Are the managed care plans always listed in alphabetical order?
Initially, they are, when you first see the Explore Your Options screen, all their available plans will be listed in alphabetical order. Unless they're already enrolled, in which case their current plan will appear at the top. And then there's another chance to change the way they appear, which is if they go in and choose, for example, a primary care provider, they can select Best Match, and it will rearrange their choices of plans to show which plans have that provider in their network, and it'll show them at the top.
I want to take an opportunity to remind navigators of something, and that is that the Healthplanfinder is to be used only when a client asks you to support them in making a change, or they have any kind of questions about the coverage they have that you can help them with. It is not to be used for eligibility checks or to go in and find out what plan somebody has because they have an appointment in your clinic. That's what their Provider One card is for, or their insurance card is for. So please only use the Healthplanfinder for the reasons that it's supposed to be used for.
Can you please explain again what exactly is fee-for-service or coverage without a managed care plan?
Fee-for-service coverage is when a client goes to the doctor and they're not enrolled in managed care, so it's coverage without managed care. They go to the doctor sees them, and then the doctor bills the healthcare authority for that visit. So one of the things that pieces of sort of misinformation that goes around is that if you have that open coupon and you don't have managed care coverage, that it's easier to go to the doctor because you can go anywhere you want. But what that really is you can go anywhere you want and see any doctor who will take that fee-for-service card, and that is becoming less and less frequent that doctors do want to see clients on a fee-for-service basis.
If a client gets auto-enrolled because they did not choose a plan that same day, but then go in and choose a health plan the next day, could they get introductory materials from both managed care plans?
It's possible. It will depend on the timing.
Is the Lighthouse managed care plan used in some of the screenshots? Is that a new managed care plan? I've never seen it before.
It was fictitious for the purposes of training slides.
Will clients still receive a booklet, a Provider One card, a managed care plan card on the same timeline as they do today?
Yes.
Okay. Will clients be able to compare Apple Health managed care plan benefits side by side before selecting a managed care plan?
The Apple Health benefits are exactly the same across all 6 health plans. The value-added benefits and the incentive benefits that are provided by individual health plans are not. So a client would have to go into the plan-specific website to find out what those additional benefits are.
And we are adding the plan-specific websites into some of our materials now, particularly because this has been coming up as a question.
If a clinic or doctor is no longer taking Apple Health clients, will Healthplanfinder be up to date with this information?
We are reliant on the managed care plans to update the information in Healthplanfinder. We ask them to do it every month, but again, we're relying on them to do it. So it's possible that they would, not get it done right at the right time, and somebody could select one of those primary care physicians thinking, oh, that's who I want to see, so I'm going to take that plan, only to find out later that that physician is not in that plan. On the screen, it reminds them please call the plan to make sure that this physician is accepting new patients and is still part of the network. There's a disclaimer on there because there is so much difficulty in keeping this current. A lot of change goes on in these networks.
And an even better idea would be to call the provider's office and make sure that they are contracted with the plan that the client wants to enroll in.
If a provider name is available to choose, does that mean that they are accepting new patients?
It does not, but it also doesn't matter. I know that may not make sense, but if the provider, let's say the provider's name is George Smith, it will say accepting new clients yes or no on the screen. Even if it says no, they can choose that provider because it's possible that's already their provider. You know, they're just in there looking to see, is my provider in the network that I want to be in? I don't want to have to change providers, even if I'm changing, maybe moving or something. So the best bet, I think, like Allison said, is contact the provider directly to make sure they're in there. But they may or may not be accepting new clients. It will say that on the screen, but again, we don't know that it's always current.
Okay. Is there a limit to how many times a person can change their managed care plan per month? For instance, if a person decides to go with coordinated care, then reads up on the services that same month and realizes that Molina would be a better choice, are they able to change to Molina and have coverage the next month, or do they have to wait to change it the following month?
They can change it that month as long as they change before the second working day before the end of the month. So if, you know, I mean, theoretically, I suppose you could change many times during the month, but we don't recommend it.
What about an American Indian, Alaskan Native household with a non-Native member? Can they be assigned to different plans? They all have to be, everyone who's Apple Health eligible and decide to select a plan, then they would have to be on the same plan. Most likely there are going to be bugs when May 11th comes around for managed care plan selection. What is the best number that we can call for immediate assistance? So I would think you would just use the phone number that you currently do today, which is 1-800-562-3022, which is the Healthcare Authority Medical Assistance Customer Service Center.
I think it kind of depends on what it is, too, that you come across. And so one of the things that we wanted to encourage people to be on the lookout for is anything that looks like it's not working correctly. You know, it is possible there will be bugs. Hopefully that won't be the case, but if so, I hope you would report that quickly.
Who would they report that to? I think that's the...
So we've worked with all 3 call centers, the 2 at HCA as well as the customer support call center for HBE. So I think they're all prepared to take people's phone calls, and then based on what it is, they will triage and decide, do they need to report something to us that's not working properly.
Where can we get the email contact information if we have questions for QHP, brokers, and in-person assisters? And on the current slide, at the bottom on the training and education webpage, the training video that we played today, as well as the presentation slides, are already located on that under webinars. So you can go, and it was the second to last page in our presentation today.
Karen, did they ask about questions for QHPs?
Which we listed that under customer support on that slide.
On the last slide.
Okay,
so it's not on the slide we're looking at now.
No.
Right, but they can find it at the second link on this slide.
Okay, thanks.
Yeah, there was the slide that had who navigators call, who brokers call, and so forth. That's in the deck.
So what happens to all the Apple Health clients currently not on a managed care plan as of Monday, May 11th? Is Provider 1 going to auto-enroll all Apple Health clients?
No. Nothing different will happen to them.
Can you explain what add-ons are that you mentioned earlier today?
Well, this is Allison Robbins with the Medicaid Managed Care Program. We don't really refer to them as add-ons. We refer to them as value-added benefits. And a value-added benefit is something that you get by virtue of being enrolled in the managed care plan who provides that benefit. Incentives are items that you can get. For example, if you bring your baby to all the well child exams for the baby's first year, then you can get a stroller or car seats or something like that. A value-added benefit would be eyeglass hardware or a Weight Watchers membership or Boys and Girls Club memberships and something like that.
And these are offers made by the managed care plan that are above and beyond the essential benefits that they all must provide.
Yes,
right?
and they vary from plan to plan.
Okay, a few reminders before we end our webinar. Again, we posted the training video and presentation slides to the HCA Training and Education webpage, and we'll share and we just shared, we have the link listed, the second option on this page. An updated webinar recording that will include our question and answer session from today will also be added to that same webpage in about 1 week. We thank you for joining us to learn about Medicaid plan selection, which is going to begin on May 11th.